Hello, my name is Mike McKee. I'm a family doctor, and I am deaf. I have a cochlear implant. Let me tell you a little bit about myself. I was born and raised in Florida in a hearing family. My family didn't know that I was born deaf from a genetic cause. Later on in high school, I had to figure out what my life path would be, what I would be doing for work. My parents were very supportive. They really encouraged me. Other people were more discouraging. When mentioning a career path, they would say, pick something more reasonable, something more appropriate for a deaf person. When I was a teenager, I met a few deaf professionals. Wow, that really helped me. I realized that I could get a good job and in a career like engineering or computers. I hadn't met any deaf doctors, so I didn't know much about the medical field. Regardless, those deaf professionals were a great influence on me. They really helped broaden my perspective on wonderful possibilities out there. I ended up going to Lynn University. I also added some science courses. This was close to FAU, Florida Atlantic University, near where I grew up in southern Florida. When I graduated, I had a degree in political science with a minor in chemistry. I know, that's a strange combination. I decided to attend medical school just before my senior year. It was a last-minute decision. In the middle of college, I had decided to go to veterinary school. I had already taken courses that were the same prerequisites for both veterinary school and medical school. So when I decided to transfer, it was pretty easy to do. So I decided to hurry up and take the MCAT, a medical test before being admitted into school. I quickly took the test and passed. Then I sent in my application for the University of Florida's medical school. It was one of 3 medical schools in Florida. I was accepted, which was very exciting. I had told them I was deaf, but it was critical to be open and honest and really show them who I was, that I was proud, and I needed to show them what I could do, show them the types of equipment I had. Before going into the interview, I contacted a number of deaf doctors and asked them about the types of equipment that they had and their types of experiences. That way, I knew how to plan for the interview. The interview would feel out if and how well I could communicate. What was important was to feel confident and to share information with them in order to educate them. It was a great interview. I really enjoyed myself. I met with 3 different doctors. It was a good experience, and I was accepted soon after. I was really excited about it, but what else helped me to decide to go to medical school was, before that summer of my senior year, while I was thinking of how medicine would be a good fit for me, it was also important to shadow a doctor to see if it was really what I wanted to do. I shadowed several different careers. I was really encouraged by that. I really loved the family doctor that I shadowed. They were our own family doctor. It was a great experience following them and seeing what they did. It also helped me to identify my limitations and where I needed to plan to go for help before I started. They had gotten an interpreter in training for me. The medical school was strange because, although everyday words were spoken, there were a lot of long medical words too. So I started meeting with the interpreter to help train them. That started at the end of my first year. I had the transcription service along with an FM loop system, which worked okay. It helped. But the interpreter needed some help, and after that, we were all prepared. After we felt we could communicate well, they stayed with me for the rest of the time. If there was any negative aspect of medical school, well, most of the time I had a positive experience. I felt comfortable sharing my experiences, and it was helpful for the other students who might not have known what to do with a deaf person. So, during the first week of school, I introduced myself and told them that I wasn't anyone to be scared of, that I didn't bite. I typed up my story and emailed it to them. That explanation of who I was helped them feel more comfortable with me. I explained that they needed to get my attention and speak directly to me so I didn't miss anything. Also, the role of the interpreter. That education would hopefully help them in the future if they ever had to work with a deaf patient too. Interestingly, many professors were concerned that patients would not accept you, but I never had patients refuse to work with me. It was more the professor's concern than the patients. The patients wanted a person who would look them in the eye, who would take care of them, who were knowledgeable. Being deaf didn't matter. As long as I could communicate with them, talk with them, they were fine with it. In fact, they were encouraging. I never had a person refuse and say he didn't want me. So, I recommend that if you're interested in medical school or in a medical profession, I encourage you to shadow a few professionals in different fields, because that experience is helpful. There are many of them: doctors, vets, or maybe scientists or researchers. There are a variety of them out there. So I encourage you to go out there, experience, learn, see what fits you best. Medical school, in my opinion, is definitely possible. It doesn't matter if you're deaf or not. They have access services available, and luckily now, there's a lot of cool technology. Different equipment like stethoscopes, which can be used with a cochlear implant or with a visual display. Now is the time, compared to years ago, that was much more difficult. Now, there are a few more options. I also want to encourage you to prepare yourself, to think ahead. For example, if you know there's a surgery coming up soon, like in the next 2 or 3 months, don't wait until the last minute. Meet the director. Ask what they think. Do they foresee any problems that you can overcome? Really, it's a lot of work, yes. So be ready for that. Be more willing to do the work and educate yourself more. Prepare. All of that will help your ability to adapt or fit the situation. More education always helps anyway. It doesn't matter if your goal is in medicine or other sciences or teaching. I encourage you to have a broad education. That helps.